Hello. Today I'll be doing my presentation on leukemia. Before we actually get into leukemia, we actually have to talk about the anatomy and physiology of the blood, which is the body system that leukemia affects. The blood is actually a connective tissue and it's made up of extracellular matrix and cellular elements. And those cellular elements are erythrocytes, leukocytes, and thrombocytes, which are platelets. Um, these cellular elements sit in plasma, which enables the cellular elements to circulate through the cardiovascular system. Functions of the blood. The primary function of the blood is to deliver oxygen and nutrients to the body and remove waste products from cells and organs. Some more functions are transportation of nutrients and disposal of waste products, defense from disease causing bacteria and viruses, maintenance of homeostasis with regulating our body temperature, our blood volume, blood pressure, blood pH, and blood glucose levels. Blood is also essential to metabolic and immune system function. Defense. Leukocytes, or white blood cells, protect the body from external threats and seek out and destroy internal threats like cells with mutated DNA that could mutate and become cancerous or become cells infected with viruses. Also helps our body with maintenance of homeostasis. With defense, blood passes through the vessels of the skin, and heat would be dissipated to the environment, and the blood returning would be cooler. Blood also helps maintain chemical balance of the body and regulates the water content of body cells. What is leukemia? Leukemia is a malignant progressive disease in which the bone marrow and other blood forming organs produce increased numbers of immature or abnormal leukocytes. These cells suppress the production of normal cells, leading to other blood disorders. And this is a picture of the proliferation of cells in bone marrow and how the normal bone marrow, there's a lot less cells here, and with the growth and formation of the mutated cells causing the proliferation. There's actually different types of leukemia, and it's broken down by acute and chronic. And acute leukemia is the controlled proliferation of partially developed white blood cells or blast cells, which develop in the blood over a short period of time. With acute leukemia, progression is fast growing and progresses quickly without treatment. With chronic leukemia is partially developed white blood cells in the blood over a long period of time. These cells interfere with the development and function of healthy cells. And it actually breaks down even further. With acute myeloid leukemia, it progresses rapidly and affects blood and bone marrow. Acute lymphocytic leukemia progresses rapidly also and affects the bone marrow and blood. Chronic lymphocytic leukemia grows slowly, starts in the bone marrow, and spreads through the blood. With chronic myeloid leukemia, it begins in blood-forming cells of bone marrow and spreads to the blood. And there's also a very rare type of leukemia called hairy cell leukemia, and it progresses slowly, and it develops when bone marrow makes too many B cells. So for acute leukemia, acute myeloid leukemia is a mutation of precursor blood cells in the bone marrow due to a chromosomal translocation or due to an abnormal chromosomal number. It mostly affects people older in age, and with acute lymphoblastic leukemia, it's most common in children, and it occurs when a bone marrow cell develops errors in the DNA. Both types contribute to the accumulation of blast cells and interferes with the development and function of leukocytes, erythrocytes, and platelets. Chronic leukemia, chronic myeloid leukemia, typically affects older adults and is caused by a chromosome mutation that occurs spontaneously. It affects the granulocytes and causes the cells to divide too quickly. With chronic lymphocytic or lymphoblastic leukemia, it affects the lymphocytes and B cells, resulting in them not working effectively and weakening the immune system. The cells don't die as they should with this type of leukemia. In chronic types, the cells mature only partially, where acute cells don't mature at all. The causes of chronic types are chromosomal abnormalities in the hematopoietic stem cells. When they're destined to become leukocytes, it's the most common cause of chronic leukemia. And these chromosomal defects include chromosomal deletion, which is part of where part of the chromosome is missing, trisomy, where there's one extra chromosome, translocation, where two chromosomes break. And with these chronic types, too many premature cells crowd out healthy cells, and they spill from the bone marrow into the blood, organs, and the circulation. Some signs and symptoms of leukemia. Unfortunately, many patients don't experience symptoms during the early stages, but if any symptoms do develop, they include flu-like symptoms such as night sweats, fatigue, and fever. You could also experience loss of appetite and sudden weight loss, bone or joint pain, headaches, and shortness of breath, and frequent infections and easy bruising or heavy bleeding, and also in children, skin rashes. To diagnose leukemia, it can be diagnosed in different ways. A physician may discuss your medical history to check risk factors and do a physical exam to check for swollen lymph nodes or other areas. You could also do blood tests, bone marrow tests, gene tests, biopsies, and imaging tests. Some other conditions that may be signs of leukemia are anemia, which is a low red blood cell count, leukopenia, which is a low white blood cell count, which ultimately weakens the body's immune defense, thrombocytopenia, which is a low platelet count, swollen lymph nodes, and an enlarged spleen or liver. Some risk factors for adults. Adults age 65 or older are more at risk for leukemia, but also any long-term exposure to radiation or carcinogenic chemicals like benzene could also be a risk factor. Smoking, family history of leukemia, certain blood disorders, and certain congenital syndromes. Some risk factors for children are inherited immune system issues, having a sibling with leukemia, radiation exposure, exposure to chemotherapy and other chemicals, and immune system suppression. Some treatments include, but aren't limited to, stem cell transplantation, radiation therapy, chemotherapy, targeted therapy, removal of the spleen if infected at all, surgical removal. Unfortunately, there's no known way to prevent leukemia in adults or children, but some preventative measures may be avoiding tobacco and avoiding exposure to certain chemicals and pesticides. And it's also good to maintain a healthy body weight and eat plenty of fruits and vegetables and superfoods to help build your immune system. And here are some different types of leukemia. The acute lymphoblastic leukemia is found in the lymphoid cells. It grows quickly, and it's common in children, and there are about 6,000 cases a year. Acute myelogenous leukemia or acute myeloid leukemia is found in the myeloid cells. It grows quickly and is common in adults and children, and there are about 18,000 cases a year. With chronic lymphoblastic leukemia, it's found in lymphoid cells. It grows slowly, and it's common in adults 55 and older or 65 and older, and there's about 15,000 cases a year. And chronic myelogenous leukemia, found in the myeloid cells as well. It grows slowly and is common in adults, and there's about 6,000 cases per year.